I think people who are just fertile have it in their genes. And these patients that are getting pregnant in their late 40s, it is definitely probably genetic.
That kind of goes into this next person's question. So women that have a lot of babies, that have large families, I feel like those are my friends that seem to be having more babies in their 40s, mid 40s, late 40s,
Yes.
you know, and I don't know if it's because they're just that much fertile or because they've expanded their window of fertility by being pregnant a lot. And it kind of goes into this woman's question. What happens to the eggs during pregnancy? She's had 12 babies, and she's just wondering, she spent much of her fertile years pregnant, right? Or in postpartum. So she was breastfeeding babies, right? Yeah.
That is, that's awesome. I'd like to talk to her. How does she do it?
I know, right? 12 babies. I love it.
I have 2 kids. I don't even know. But you can actually, I had to look this up, but this is interesting. When you are born, you're born with, wait, let me get my numbers out. You're born with like 6 million eggs. And, okay, you're born with 6 million eggs as a fetus. When you're born, it goes down to 1 to 2 million eggs. So you're born with the eggs you're going to have the rest of your life, if that's crazy enough. Then when you go through puberty, it drops down to about 300,000 eggs. And then you start losing, before puberty, you start losing 10,000 eggs a month. After puberty, you lose about 1,000 eggs per month. And that is through pregnancy. So your pregnancy, you really don't ovulate. So obviously you only lose that one plus the 1,000 you're already going to lose. But if you're also breastfeeding, that also you'll also lose an additional egg per month then. But really, what we're seeing with menopause is a high percentage of patients, it is genetic and inherited. So really what your mom, now it can be hard. If your mom had a hysterectomy, you won't know.
You just don't know.
But you don't know. But really, it's an inherited trait. But also the number of kids you have, yes, can delay when you go through menopause, but it's probably going to only be about 1 or 2 years, to be honest. It's not going to be 10 years. But I think people who are just fertile have it in their genes. And these patients that are getting pregnant in their late 40s, it is definitely probably genetic. And that's something, I hate to say it's not something they're doing, but, there are a lot of factors with fertility. They age. I definitely think women are delaying, getting pregnant. That is definitely number one. And if you delay to 33, 35, your percentage is already dropping at about 35. So I try to talk to my patients about that. Unfortunately, we haven't been able to extend the fertility age that much with all the science out there. But 2 is smoking, alcohol, lifestyle, a high BMI, lack of exercise, I think stress, all of those factors. Yeah. And what about the use of plastics and like toxins in our environment? There's a lot of things I think that we don't know that contribute to fertility. So
yeah, my friends that have larger families, so like 6 or more, I have 4, but I've had 6 pregnancy. But my friends that have like probably 6, I have a lot of friends that have between like 6 and 10 kids. I feel like 12 is a lot. I probably know someone, but I have to like rack my brain. But I know a lot that are like between 6 and 10. But honestly, these women look amazing. Like they look way younger than me. Like they're my age, but they look way younger than me. And they have like just this beautiful like skin that's like it's not wrinkled. Yeah. And I'm like, why? I'm like, well, why? I see why your husband keeps getting you pregnant because you're gorgeous. But like, I don't know if it's the hormone change. I don't know what it is, or if they just have really good genes anyhow. But I feel like all my friends with a lot of children, I'm like, they look amazing.